Grumble and Growl on Oria TV. Welcome back to Grumble and Growl. I'm Gail Tosh, your host, as we examine issues from the local to the global perspective so that you can make better choices. As you know, if you've been keeping up, our theme of the week is contraception access. If you have kids, or if you've ever spent time with them, you know the choice of whether or not to have them is a big and lifelong decision. And it should be just that, a choice. Sadly, that's not always the way it is in the old U.S. of A. And since we have the High Court of Gilead rolling back our reproductive freedoms, protecting access to resources that can prevent pregnancy in the first place has become even more important. Now, Republicans will say they don't want to touch birth control access. But keep in mind, the same bastards also said Roe v. Wade was settled law. And look how that turned out. Now, just last year, Senate Republicans blocked a bill that would have codified the right to birth control on a federal level. And when Roe was overturned, billionaire sugar baby Clarence Thomas said outright that the court should reconsider cases like Griswold v. Connecticut and Einstein v. Baird. For those of you who are not Supreme Court junkies, both of these cases are all about birth control access. Something smells fishy. There's a reason why this map of the country's teen pregnancy rate looks a lot like this one, which is the electoral map. Red states are more likely to have less or no sex education in their schools, which means people are less educated about their options when it comes to contraception. And a lot of times, they're screwed when it comes to accessing it. As many as 88% of young people report struggling to access birth control. And how can we expect our kids not to have kids if they don't have the tools they need to protect themselves? More than 19 million people with uteruses in the U.S. live in contraceptive deserts. And no, I am not talking about the Mojave. Contraceptive deserts are places that lack access to the full range of options for birth control. So you have to drive a long way to get your care, which means taking time off of work, arranging childcare, back to the same old drill we were talking about earlier. There are so many hoops that you have to jump through just to exercise your reproductive freedom, which is basic health care. And that's before you even get to the nightmare of dealing with doctor's appointments, insurance, co-pays, prescription costs. Again, you see the cycle we are on. It's even worse for Black and brown communities and low-income communities, which have the highest rates of unplanned pregnancies. So, what can we do about this? It seems like such a huge problem that it's hard to know where to start. Lucky for you, we did some research. We're going to have 3 different points of action that you can take. Number 1, identify your nearest place to get birth control. Number 2, make sure the young people in your family have the resources they need. And number 3, call your representative and advocate for codifying birth control access and reproductive freedoms on the national level. Comment below when you've done one of these things. And remember, these are our basic rights to bodily autonomy we're talking about. So let's fight for them. As always, if we made you laugh or we made you think, like, subscribe, and share this video. And if you could throw us some money to keep the show running, much like getting an IUD, it ain't cheap. All right, thanks so much for now. Bye-bye.